always having some agreements with them. They don't go out of them. Okay, so a study has some local lab, central lab. They also have some pharmacokinetic MRI. Another study is going to have local lab only. Another study is going to have only central lab. And all these three studies are with only one sponsor. The sponsor has ABC as a vendor. The ABC vendor is going to do, the vendor analysis or the analysis for the parameters for all these three studies. Okay, each of the study will not have different vendors. So there will be a centralized vendor placed for the sponsor. They are going to do for all these studies which is running in the company. Okay, so they will provide us electronic transfer. Like they will have a set of data. They will have to share the data to us. So how it is done is it will be done through electronic transfer and through a secured way. So because it is having important and confidential information, it has to be transferred in a very secured way. Okay. So what are the documents required while we are performing vendor reconciliations? We require study protocol, we require data transfer agreement, we require the edit check specifications, we require the CRF completion guidelines, and the last one is vendor issue log. Okay, so for any task we are performing, we need study protocol, edit check specification, and CRF completion guidelines. These three documents are like mandatory. You should always have it open when you're working day to day on a day-to-day basis. Okay, and we see data transfer agreement and vendor issue log. These two are new documents. So data transfer agreement is we'll see at the last slides, and vendor issue log is a log where we are going to add all the issues in it. Now we are going to compare two databases, clinical database versus vendor database. So we see some discrepancy between these two databases. So we are going to create one log where we are going to put all the issues which we are seeing when we are performing this reconciliation. So that log will be rounding until the issues are getting resolved. How it is going to round? First, we will add it in the log. We will send that log to the vendor asking, okay, see, this is what is the issue. What are you going to tell about it? So we will have one column for vendor. So vendor will put their comments in it and reshare back that sheet to us. They will tell, okay, whatever is there in our database is correct. Whatever is there in your database only is wrong. Okay, so what next we have to do? Vendor is told that it is fine with their end. Next thing what we have to do is we have to clean the clinical database. How we are going to do? We have to ask the site personnel. How are we going to ask the site personnel? Through a query. Okay, so we will raise a query in the clinical database. Hey, this is what the vendor has told, but this is what is there in the clinical database. What do you tell? So if they tell, yeah, we did a typo or we did a mistake and they change the data, the issue gets closed. If they also tell, no, whatever is there in our thing is right, it will come back to a data manager. Okay, then we will discuss with other stakeholders involved medical team in it. So this is what the things are happening. And then finally it will get dragged. And then finally it will come to a resolution. Okay, so this log, so we will have like step by step what was done. Now we will have some open issues. And then what we will do is we will check what was the previous comments given from vendor or from site and then take next action. So all of it will be recorded in that log. This is usually a Excel sheet, normal Excel sheet. It will be like a template which is specific to the organization, and then that will be shared across the teams. Okay, and what are the different types of external data? As I said, we will have safety, pharmacokinetic and pharmacodynamic analysis can happen. Pharmacogenetic samples can be taken, biomarkers or that tissue samples will be taken. And then device data like ECG, MRI scans, all those will be there. And then some of the other thing is electronic patient diaries. like there will be a set of questionnaires. Nowadays, even